First, the basics. We need those newborn lungs to adapt to life outside the womb. Inside the womb, they've been taking practice breaths and taking in amniotic fluid. But now on the outside, they have to be able to breathe in air and perform gas exchange. And two key things have to happen. One, we need surfactant. Surfactant is produced to keep those alveoli open, and there's enough produced by 34 to 36 weeks. And the second key thing that must happen is that during labor and vaginal birth, that amniotic fluid has to be reabsorbed and squeezed out of those lungs. Now, if either of these processes is disrupted, we're going to have respiratory distress. Now, we're going to be diving into the different conditions soon and learning more about them, but which babies are most at risk for respiratory distress? Well, first we have our preterm babies. So these guys are at risk for respiratory distress syndrome because they're early. They had more time to cook in that oven and they don't have enough surfactant. So especially if they're less than 34 weeks, they are really going to struggle with respiratory distress. And then we have our post-term babies. So these babies are at risk for meconium aspiration syndrome. These guys should have already been born and been on the outside, but now they're overdue and they might have their first poop inside of the uterus. And if they inhale that, it's going to cause meconium aspiration syndrome. And then last is our C-section babies. These kiddos are at risk for transient tachypnea of the newborn, which is definitely the least scary of the three, but it happens when excess fluid is retained and it doesn't get squeezed out of those lungs. And if you have fluid on your lungs, it's hard to breathe. All right, it's time for our first NCLEX quick check. Babies born at what gestation are most at risk for respiratory distress syndrome? Remember, that's our preterm babies less than 34 weeks, and that's because they don't have sufficient surfactant. There should be enough surfactant between 34 and 36 weeks, so you always need to be concerned with your preterm babies about respiratory distress syndrome. Babies born at what gestation are most at risk for meconium aspiration syndrome? That's going to be your post-term babies, which are usually babies over 42 weeks. Remember, they're overdue, and so they might stool in the uterus, and if they inhale it, it's going to cause meconium aspiration syndrome. What respiratory condition is a baby born by C-section most likely to experience? Remember, that's our transient tachypnea of the newborn because of that excess fluid that's sitting on the lungs and doesn't get squeezed out.